Okay, diphtheria. Why do you have to get a booster every year for diphtheria? Um, One of the reasons is the vaccine is an inactivated toxin extract and it doesn't have a lot of antigenic determinants. So every few years you need to add the determinants, the new little, if you want to think of like them as like an MCH, a platform like your Facebook platform, your MHC platform, new determinants so that they know who to apoptose. So you need to update your diphtheria every 10 years or so. The common cold. So again, we're in the upper respiratory, right? We're up here. So you've got sneezing, congestion, sore throat, cough, rhinovirus, very common, most common of the common cold. It is a virus. So when you have cold, you cannot take your penicillin because that is not going to help. There are some other viruses that cause colds, and cold viruses replicate at lower temperatures of the nasal cavity. This is a big old picture of the rhinovirus in case you want to like send it in a card to someone. Okay, the common cold. Rhinoviruses are highly infective. So they're spread by sneezing, coughing, and fomites. So this is just sort of a vocabulary word that I wanted to throw out. Fomite is inanimate object like your desk, your phone. Your phone is gross, right? It's a fomite. You sneeze on your phone, somebody else touches your phone. That's a fomite infestation, right? You sneezed on it, like desks. You sneeze on the desk, then someone else touches the desk. Desks are kind of gross. So one of the fun things, not fun, one of the horrifying things about the common cold is that it can stay for 5 days on the desk. Gross. So a lot of times people just get the virus because they've touched things. So again, never hurts to wash your hands. Never hurts to have some really delightful, hand sanitizer, things like that. Signs and symptoms are usually diagnostic. Hand antiseptics is an important prevention major. So like wash your hands. Why is it inappropriate to treat the cold with penicillin? I sort of just told you that basically because it is a virus and antibiotics are just going to interfere with your process and it's not going to help. And in fact, it's going to eventually make you antibiotic resistant. So 2 out of 10, do not recommend. Okay, we are going to talk about pneumonia. By we, I actually mean this. So hold on just a second. Okay, so what I want you to do actually is pause this video and go to the pneumonia video. You can do mine and then the pneumonia, it doesn't really matter, but there's a separate video just on pneumonia because there's just like a bunch of flavors of pneumonia. You have bacterial pneumonia, you have viral pneumonia. It's classified in different ways. It's classified basically like, is it common? Is it something you got in a hospital? The different sections of your lungs. It's classified a bunch of different ways. So I have this video just for that. I will run through some of the things here. Basically, essentially pneumonia is you're getting liquid pus in your lungs, which makes it hard to breathe. And you have lumbar pneumonia, you have healthcare associated pneumonia. This is when you're in breathing tubes and that gets into your lungs. It can be described by the affected region or the organism or the area in your lungs. So if you watch that video, it will break that down for you and I will ask you some questions on the quiz based on that video. Bacterial pneumonia are the most serious and the most frequent in adults. So pneumococcal pneumonia, fever, chills, congestion. Basically, you can't breathe. It hurts to breathe. You probably have pneumonia. Blood enters the lungs, causing a rust-colored, you're kind of like coughing up blood. That's not good. It's caused by Streptococcus pneumoniae, and you just can't breathe. And it looks like this, if you would like to know exactly what pneumonia looks like. Infection occurs by the inhalation of the bacteria, and that can be either just in the air for common pneumonia, or it can be hospital pneumonia where you've actually in the equipment, you're getting it. Penicillin is the drug of choice, so I would probably just have to die of pneumonia. I think there's other ways. There's also a good vaccine for pneumonia right now. So here again, there's hospital acquired, there's ventilator acquired, associated, there's community acquired, and there's just different strains. So again, infection occurs by inhalation of bacteria, and where that happens can sometimes help classify the bacteria. Mycoplasmal pneumonia, it's also called walking pneumonia. This is just a different type of pneumonia. It's a different organism that instead of up here we have, does it actually say? Staphylococcus. Down here we have mycoplasmal. And walking pneumonia is like you're not hospitalized, you're just walking around with pneumonia. Mycoplasma pneumoniae is the pathogen associated with this type of pneumonia. And mucus just builds up and is colonized by other bacteria. And you have it for a while and it just makes you very tired. It's unpleasant, but it's not as serious as the other kind of hospitalized pneumonia. Again, bacteria spread by nasal secretions. Walking pneumonia is the most common in like teenagers and young adults. It's difficult to diagnose and it's treated with erythromycin. Klebsiella, this, when people say it, it sounds so cool, and I try to say it and I don't sound as, Klebsiella, I think it's Klebsiella, something like that. I will try and say it better next time. I always just think of it as like kielbasa pneumonia, and I know that's not how to say it. But Klebsiella is a type of pneumonia with the bodily, you get chills more. It's almost, not always, but very often you will see it among immunocompromised patients, especially those who are already in the hospital. And it's diagnosed by actually looking at these Klebsiella in the samples, and it's treated with antimicrobials. It's here is what it looks like. Here's little capsules. So some of you are doing capsule stains. Do you see how you can see the white on the outside? That is a positive capsule stain. Other bacterial pneumonias, there's the influenza and Staphylococcus. There's Yersinia pestis, also known as pneumonic plague. There's there's some other ones, and we will talk about classifying those in that other video. Okay, Legionnaire's disease. Legionella lives and kills humans, causes tissue damage. It has typical pneumonia symptoms, but it's not. Your pulmonary function rapidly decreases. Here is what it looks like in a buffered charcoal yeast extract. Legionella survives in domestic water sources. Domestic water sources. Most commonly, the elderly, smokers, and immunocompromised individuals are at risk. Diagnosed with fluorescent antibody staining and controlled by reducing bacteria presence in water. Sometimes you will see in the spring, the city water will taste more like chlorine. Basically, they're just trying to make sure they have no Legionella in different times. If they test even a tiny, tiny bit, they will flush with chlorine, and your water will taste like chlorine, your city water, and that's to make sure that you don't have any Legionella in your water. Tuberculosis. No one wants tuberculosis. It is the leading disease killer in the world. It has declined a little bit in the industrialized world, but it's still really common, and we get tested by tuberculosis. A lot of jobs you'll go to, they'll want you to have a tuberculosis test, and they just scratch your skin, and it will inflame if you have been exposed to tuberculosis. So in the healthcare industry, this is kind of useless, because if you work in the healthcare industry, you've probably been exposed to tuberculosis. It doesn't mean you have tuberculosis. Many countries are vaccinated against tuberculosis, so theirs also is going to flare up. It doesn't mean you have tuberculosis, it just means you've been exposed to tuberculosis. So then they will typically do a chest x-ray. Tuberculosis is bad. It's spread by the inhalation of respiratory drops. So they want to make sure no one has tuberculosis before they hire you, so that you don't give it to other people. Here again, these are alveoli cells, right? We're zooming in. This is an alveoli cell. These are macrophages. Bacteria replicate freely within here, and all of a sudden you have tuberculosis. You have these lung lesions. These are fibers. That is not good. You do not want those in your lungs. So that is, again, what that looks like. You have these sort of lesions in your lungs, and that is how they would diagnose it. They would, here it is, they would actually look for those in your lungs via an x-ray. So this is what will happen. It will inflame if you have been exposed, and then you will have to go get a chest x-ray to prove that you, in fact, do not have tuberculosis. for a lot of jobs. 1/3 of the world's population is infected. Most deaths occur in Asia and Africa. There are drug resistant